Today, we have Dr. Lara Langdon with us on the show. As a doctor of physical therapy and with over 25 years of experience, Dr. Langdon combines her extensive clinical and academic background to create a unique East meets West approach to her patient care. With her passion for cutting-edge technologies, Lara offers a diverse range of solutions for patients who have tried everything without success. Most recently, Lara has implemented Frequency Specific Microcurrent, or FSM, into her practice, a relaxing, drug-free, and non-invasive technique using low-level electrical currents to relieve pain and accelerate healing. This bioresonance can quickly reduce systematic inflammation, pain, and anxiety while balancing the entire nervous system. If you are one of those people who is on a health journey, or you know someone who's looking for ways to feel better that helps you tap into your body's own ability to heal, then this is an episode you won't want to miss. Let's grow. Welcome to the WellLIFE, your destination for vibrant, healthy living. I'm your host, Sheila Alston, founder of Healthy Home Media, and I'm here to help you take charge of your well-being beyond just diet and exercise. On WellLIFE, we'll explore everything from holistic healing to creating a healthier home environment so you can thrive in every aspect of your life. Whether it's learning from alternative healers or discovering simple ways to detox your living space, you'll find the inspiration and tools to elevate your health. Because true wellness isn't about restriction, it's about empowerment. So tune in, be inspired, and start living your well life. Welcome to the WellLIFE, Lara. I'm so excited to have you here today.
Thank you so much. How are you?
Good. So many people are dealing with chronic conditions and taking more and more medication than ever before. So I'm just really inspired about the work that you're doing to help your patients find relief without any medication using your modality of frequency-specific microcurrent. But before we dive into exactly what that is, I'd love for you to share a little bit about your background and how you came across FSM.
Oh, great. Well, I am traditionally trained as a physical therapist. I have a very grounded and scientific background in studying as a physical therapist. I started in orthopedic outpatient. I had an interest in injury prevention and injury recovery as a physical therapist, kind of down like the regular traditional route. And along the way, through different jobs and through different schooling, I developed an interest in how the body is really working beyond looking at a joint, beyond looking at a condition. How is our whole body connected? And as I started studying that in orthopedics and noticing and seeing my patients get better, some get better faster than others, I ended up going back to a program in Boston called Massachusetts General, and I received my doctorate in physical therapy. It was a new clinical doctorate that they were offering. That was about 20 years ago now, to date myself. But it was really eye-opening because I got to study with some fantastic professors and great doctors in their orthopedic, Dr. Amy Klein, Dr. Cynthia Zadai, Leslie Porter, some of kind of the really strong leaders in the profession. And I also started teaching within the doctoral program at that time. So I really got a nice East Coast introduction to how they view medicine and different modalities of healing with a very evidence-based program. Whereas on the West Coast, where I was raised in San Diego, we really look at things, yes, with science, but we are all into different modalities of energy. And there's a lot of that, especially in Encinitas where I live. There's a whole corridor of yoga and meditation and self-healing and all these different modalities. So I love the mix of looking at sort of traditional evidence-based and also adding in those type of some anecdotal and not totally proven, but we all know sort of like these different ways where we can help ourselves using less proven type modalities. And so it's been a really interesting journey. I've really followed the lighted tiles, and it's just brought me to a very cool place in my career where I've had the opportunity to both be a clinician starting out in orthopedics, but I also studied at Mass General, saw how that went, got my doctorate. And then I came back to San Diego, had my first child, Jada. And I really had an interest for looking at the intricacies of the body. And I was able to do that through UCSD, and I became an assistant clinical professor at UCSD. And for 10 years, studied the insides of our body. I taught human dissection anatomy. And I did that for 10 to 12 years between the SCAGS pharmaceutical program for pharmacist training and also the UCSD medical school, teaching the first and second year students. So I got to go to work every day in scrubs and work with tools and really look at the body head to toe. And one of the things I had a great interest in at the time was the fascia, because I think fascia holds a lot of memory, holds a consciousness, it's alive, and I love the ability of it to change. And we know that all of our cells of our body replace themselves. Our stomach replaces itself, the lining, about every 3 days. Every cell in our body is capable of resilience and healing. And I love the idea of that. I'm passionate about the idea of that because it means that all of us, no matter what state, disease, or suffering that we're in, have the capacity and the ability and the possibility to improve our lives, improve our experience of life. Some have answers, some haven't been proven, but I've gotten to witness lots of miracles. And I love that about the work that I'm doing. So I did work at UCSD for about 10 years, but then I started my clinical practice in Encinitas about 6 years ago. I teamed up with Indigo Dragon Center in Encinitas, which is kind of a retreat-like setting. So I work with my patients one-on-one. We really review what they've done, what's bothering them, kind of any medications they might be taking. I really listen to the patient, and I love that my practice setting and what I've created gives me the ability to really work almost more in a concierge way, which with each of my patients. And I think for that reason, I really love getting to know my patients inside and out. I really love to know their mental, their emotional, and it really has created a more holistic approach to the work that I'm doing now.
Well, and it's just so unique because I think someone typically with your clinical background, well, maybe I'm just making this assumption, but isn't it more so that someone with such a clinical or scientific background doesn't really see the connection of mind and body and look for a holistic approach, or right? I mean,
Well, I have gone into a little bit of a tangent, a little bit of a niche, but I think that we're going that way more of as a society and as a need, because there are a lot of people that have been following a more Western medicine approach where they're taking medications and it's not serving them. It's not getting them better. It's not getting them better all the way. And we could have a whole discussion on COVID and long haul COVID. And I think they're experiencing a lot of undesirable, unacceptable side effects from medication because that medication is going through the more chemical pathway of the body. That is to say, there are chemicals produced when you take a medication. Acetylcholine is going from synapse to synapse, and there is an effect on the body. It has to be processed through the liver. Everybody's body is a little bit different, or more sensitive or less sensitive. So medication doesn't work on everyone in the same way. And I think that there are a lot of people that are working with a number of complex conditions in their bodies that they can't make sense of. And so in my practice, I'm able to really take the time with people and one-on-one situation and really ask them what's going on and what they're experiencing. And from there, I am able to do some differential diagnosis and try to figure out what is the anatomy, what is the condition of that anatomy. And that's what I've come to be doing as the primary modality that I'm using in my current practice, which is called Frequency Specific Microcurrent. So I can describe that if you'd like.
Yeah, no, please go ahead. I mean, one thing before you get started, I just want to say that it's amazing that I don't believe that every practitioner has the burning knowing that your body can heal itself, right? I mean, I do feel like I have talked in my own personal experience to doctors who just kind of, I know that they want to help and their desire is to help, but they're kind of like, well, it's limited because this is a progressive disease or this is something that can't be cured. So if you believe that, you know, how can you help your patients do anything but just kind of manage symptoms, right? So I do think that if you are someone who is looking to heal or looking to eventually not be on so many different medications, that you want to look for a practitioner whose ultimate belief is that your body can heal,
Right.
and that their goal would be to try to, help you manage that and get off certain
Mhm.
medications. So
Right.
yeah, so tell us what what frequency microcurrent is,
Right.
specific microcurrent.
Well, first of all, just to address what you just said, I I have a great faith in our medical system. I
Mhm,
think that it's not perfect. I think that there's a lot of doctors who are doing their best. Their schedules are slammed. The
mhm,
medical system is broken. If we want to just make that statement, I think
mhm,
that doctors in general get up in the morning and they have a strong passion to heal their patients.
mhm, mhm,
And I know a lot of fantastic doctors that practice in the Western medical. So would never put them down, but I
mhm,
believe that sometimes things can slip through the cracks because a
mhm,
doctor might have this specialty and then a patient has to go see a doctor in a different specialty. And then, and we're connecting all these different dots. And unfortunately, it's not one person that has a comprehensive look at the patient. And often, they're given medications that sometimes interact with each other, or
mhm,
the doctor doesn't have something, a medication that is taken in their record. And so it's unfortunately, it feels like it's not a coherent look at
mhm,
their true health. And so I'm fortunate when I am working with somebody that I have the time and I make the time. And I
mhm,
think the patients appreciate that they're able to really be heard, because
mhm,
patients, people really do have a pretty good idea on what's going on with them. And I always ask patients, what do you think is going on?
mhm,
And I don't know that doctors always have time to listen to it.
mhm,
And so it's
mhm,
really not their fault. It's the position that they're in. Some of them are seeing 40, 50 patients a day.
mhm.
So I've created a practice where I'm not doing that.
Yeah.
And I'm really lucky and fortunate, and it's sort of my dream job. I get to go to work. I get to understand my patients, really listen to them, take the time to kind of dissect what's going on, no pun,
Yeah.
and explain to them what's going on. Because I think once you are on board, you understand a plan, you understand what's going on with your body. There is a mental and emotional buy-in to your healing. Right.
Mhm,
So most of the time, or some of the time, you go to a doctor, you're given a medication, you're not really explained what it's doing. You just take it, and there's no real buy-in necessarily, because you're just going to experience it and you're going to experience side effects. But
mhm,
I really try to involve the patient in their own healing, starting
mhm,
with if somebody comes in and they have, like, say, a knee issue, I'm like, or what's going on with their body. If they have mold, Lyme, shingles, anything, how do you feel about yourself? How do you feel about your body? If you were to
mhm,
answer the question, I feel blank,
mhm,
how do you feel about your body? And I get so many really interesting answers. I've had people say, I feel broken. I
mhm,
feel ill. I feel afraid. I feel frustrated. And that is a starting point, because how you feel about your body will create an energy or a resonance or a bioresonance in your body. Are you in resonance with your body? Are you on the same team? Or are you in an antagonistic relationship with your own body? If you are, your healing, it will be slowed at minimum, and it may prevent you from healing because you are at odds. So
mhm.
that's one of the very first things that people can even do in looking at their own health from their home right this second while we're talking, is like,
Right.
how do I feel about what's going on with me?
And
Right?
did you get this like knowledge from the work with the frequency, or did you kind of know that before you started? Because I remember you telling me that in
Yeah.
all your years of practice,
Mhm.
this modality has been
Mhm.
making such a huge difference. So,
Right. I would say that I've been practicing for 30 years, and I've picked up ideas, experiences, and I've witnessed how people most efficiently and effectively heal.
mhm,
And those people that have a buy-in and
mhm,
have a love of their own body and have a forgiveness and a gratitude toward their condition
mhm,
heal faster. And that's what
mm,
I'm interested in doing with people. So that's often where we start, is to get that on board,
mhm,
because then they are going to continue to promote on a daily basis the mindset, the self-talk, the approach. Much like if you if you're driving and the gas light goes on in your car, are you mad at your car? Or are you like, oh, thank God, I'm going to pull over and get gas so I don't run out of gas? Which
Right.
I've run out of gas.
Well, people don't realize that the angry thoughts are actually producing
Yeah,
chemicals in your body in that moment.
absolutely.
And
Absolutely. And
you
they're
can't,
producing.
and no organism can live on stress forever and not get physically sick, right? So that's what we're
Absolutely.
doing to ourselves.
Absolutely. And so, yeah, this whole idea of frequency that we're talking about, yes, I have some, I'm giving some of my own ideas that I come over time about healing in general. I've been working in healing for over 30 years, and I've made a lot of observations and witnessed some amazing things. So yes, I have put together a lot of my own thoughts about it and worked that into my specific practice. If we're talking specifically about the modality that is my absolute favorite modality right now, which has really become the center point for my practice, and that is frequency specific microcurrent. And so frequency, as we know it, as defined by physics, is a rate. It's a wave. It can be an energy wave. It can be a sound wave. We all can relate to music. When we listen to music, we are listening to frequency. If we want to listen to certain measured frequency, say 432 hertz, we can listen to binaural beats or a lot of meditation things. That music can instill a feeling in us, a feeling of energy, a feeling of relaxation. We've all experienced that. So that's how we can feel sort of a specific frequency. And there's a lot of music that really, like if you've ever heard, What a Wonderful World, does that make you high and energetic, or does it make you just like, oh, I love that song, nostalgic? So we all have the experience of feeling music and feeling vibration, and we're very much aware of it. In fact, we have interpersonal frequency with each other. So there's an energy to being with a friend who's like super up, and you feel better after you leave the conversation. You feel better by just being with somebody, right? Pets are amazing at that. If you have a dog or a cat, like their frequency is very, very high that exists with them, because we have a frequency that's running in our body that can actually be measured, right? If you're with somebody who's complaining or Debbie Downer on Saturday Night Live, you call that person like an energy vampire. That person, what you're feeling really is you're at this frequency and they're at this frequency, and you feel pulled down. And we like to be at a certain frequency in our body. I think it's 62 to 70 hertz. So when we go lower than that, not only do we feel emotionally and mentally drained, but we actually could measure that there is a negative effect at the cellular level. That is to say that we like to be at a certain voltage, but we actually start becoming ill at the cellular level, more toxic, less efficient, less resilient, when our frequencies are taken below that. There's a polarity, an electricity to the body. A great example of something coming up tonight and tomorrow that I already felt last night because I couldn't quite sleep well. When there's a full moon, we see an effect of the waves, right? The tides change with the full moon. We can feel that in our body because we are largely water. So the same way it's affecting the tides, most people don't sleep well during a full moon. And the full moon, I think, is Thursday night, and it lasts a couple days before that and a few days after. So I always notice that my patients come in and they're like, I just haven't slept in a few nights. And I'm like, that's because you're feeling the polarity of the moon, and where we like to be in voltage in our body is a little bit more electrically negatively charged. Okay. That's not emotionally, it's just voltage. The full moon exerts a very positive effect on the earth. The earth is more negative, so it supports us. So what I tell my patients to do is I have them make sure that they get their feet on the ground. I'm gonna just get grounding. This up. Yes, grounding. So what happens when you take your bare feet and you put them in the sand or the water at the beach or your backyard on real turf, on real ground, not cement, is that your feet can actually pull in the electrons that the earth has, because it is more electron positive than your body. So your body will automatically pull that in. So it's a really easy thing to do. I just have my patients, you need to spend 20 minutes grounding, getting your feet warm in San Diego, go to the beach. The other way is getting sunlight. So sunlight has an energy to it that makes us feel better. And that is because we're changing the actual voltage in our body. So there's lots of ways that we can already feel this in our body.
So wouldn't you say that, just society in general 100 years ago was spending a lot more time outside and naturally playing out in the dirt and in the ground or whatever, just grounding? Naturally, we're all inside watching TV, working on the computer. We're not going outside as much. We're not getting sun as much. So I can see how just society in general is sort of getting sicker because of that.
Right. And so that's a good point. Nature and animals are tremendous things to do for yourself. If you're feeling a little down, go for a hike out in nature, breathe the air. There's far more electrons in nature and outside. And even advertising picks up on this, because if you look at an advertisement for a vacation, you are being shown the ocean, you're being shown the mountains, a stream, you're looking at people happy outside. You never see an advertisement for a vacation to an exotic place and they're showing you on a computer inside.
Right.
They've really tapped into that, and we all have that experience. Everybody goes on a vacation and they're outside more and they're less on their computer, or they're a student and they're not on their, they're on a break. We feel like, oh gosh, I feel like my stress is kind of gone. I feel like I'm on vacation. We come back from a vacation, we go back on a computer, we go back on social media. And it's just like, oh, it's so hard to come back from vacation. But really, there's so many things we can do to sort of stay on vacation all the time, stay in that mindset. So frequency specific microcurrent is a way. I actually employ, there are devices that are 2-channel, and I use 4 of them at a time on a person. And the 2 channels there are numbers that correspond to the actual frequency in a number, measuring the megahertz or the hertz, and then a condition for the other channel. So
it's not, is it the same for all your patients that come in, that you give them the special frequency numbers, or how do you?
So there are thousands of frequency numbers, many of which get memorized or used often, but there are very specific frequencies for every part of the anatomy in your body. Your eyes, your retina, your sinuses, your certain types of joints, certain types of fascia, muscle, ligaments, brain, the medulla, where the vagus nerve comes out, nerve tissue, muscle tissue. So there's some skill in the employment of choosing those numbers and the frequency. And that is what I have. I'm fascinated with it. I've spent a lot of time with it. I've fortunately learned a lot on my patients, and I dig it. And that's why I'm doing that, because I'm able to sort of fine tune somebody into their zone. And just to back up what this looks like, if a patient comes in, is very relaxed. Somebody lays down. I put wet towels around their neck or on their belly, over their feet, and they're just resting comfortably, put a little music on. And then I connect leads from towel to towel, say from neck to feet or neck to belly. And what I'm doing is I'm exerting a micro stim, a frequency between the 2 towels, and they are the semiconductor, right? So I'm creating a resonance that's reaching specific anatomy and the condition of that anatomy. Okay. So for instance, it could be spinal cord inflammation. Okay. Spinal cord inflammation is a big problem with your nervous system, because it's your brain and your spinal cord. And that is how you receive information about your environment or about a disease or an illness or a condition in the body. And then your brain makes a decision of what we're going to do with it and how we will respond. If the brain and the spinal cord have inflammation in them, there's going to be a distortion between the receiving of the information and the data coming in, and then an even bigger distortion with what's coming out as the message to the body and how to respond. things that can cause inflammation of the spinal cord, any chronic disease, nervous disease, Lyme disease, mold toxicity, shingles, vaccinations. I put myself out there, but vaccinations can cause reactions and things like that. COVID causes that. In fact, they've studied brain fog and why that's happening. Brain fog is an inflammation, extra fluid in the brain where it shouldn't be. And so they are studying those things. And I'm not taking any sides here or being political, but I'm seeing a lot of long haul COVID symptoms where people are just continuing to have issues, sometimes 10 or 12 things that they can't connect. But the way that I'm looking at it is, if there's an inflammation in their central nervous system, the mothership that's receiving and giving out information, nothing's going to quite make sense. And so I really love working with those people that are still struggling with things that came from either a vaccination or getting COVID, because pretty much everybody has had it by now. And some people are doing okay, and some people are still struggling with pain, with respiratory issues, with immune system issues or autoimmune issues. And I love looking at those things because I can use my lens of how I look at the body, and I can see the entire system that's causing more of a holistic problem, and kind of a magnifier of anything that may have been an issue before is now amplified when there's an inflammation in the spinal cord. So with the frequency, 40-10, 40 is inflammation, 10 is the spinal cord. I can actually run that from neck to belly, and their body being the superconductor, it's seeking out the cells and the ATP in the cells of all of the connections in the spinal cord. And it's doing it quickly. It's doing it without any side effects. It's very pleasant. It's almost subsensory. And what the patient will experience, and you can talk about your experiences. My patients all feel very calm. My patients feel like energy is moving. You're actually not feeling the stimulation in the tells, but you're actually just feeling how your body's responding. And there's a bit of an effect like a tuning in a radio. So if you're tuning in a radio and the signal being given is 101.3, and that's where it's being received in that resonance, right? You're going to have a clear signal, right? And so in the same way, I'm sort of tuning in those cells at that level. And it's believed to work by increasing the ATP within the mitochondria of the cell, about 500%. So what we're actually, the way I describe it is almost like a light bright. We're just taking a cell that's become a little bit less responsive, a little sluggish, can't bring in the nutrients or dispose of the nutrients into the cell, eliminate the waste. It's become a sluggish system, right? We can get to all of that and relight it up almost.
How many times does it take to get the effects, would you say? Like, I came once, and I would definitely say I was very calm. I loved that feeling of feeling energy. I feel like we all have had the sensation of getting goosebumps or something. It's a little bit kind of like that without so much the goosebumps, but just, I don't know, it feels good, right? But I'm wondering, for your patients who have had some relief from some of their symptoms, how many times does it take for them to come and have the treatment done for it to kind of work?
So it's a great question. What I love to tell people is the great thing about FSM is normally even one session, sometimes two. Really, if they're not having a significant feeling of difference by the third, then we're targeting the wrong tissues and we need to do more investigation. So this is not something where you have to come for 3 months, 3 times a week, and then you'll find out if it's working. People know quite quickly, and I text people the same day they come in, later the next morning, how did you sleep? I'm looking for any kind of change in their nervous system, especially because that's always where we start, is the central nervous system. You've got to start with the nervous system when you're looking at absolutely any type of illness or disease. It's the fastest physiology and system in our body. It's like we step on a pin, we know it immediately, right? And our brain has the capacity to understand and assess the pain or the discomfort we're having, and it has a very fast response. And so we always start with the nervous system. And so I'll start there. People notice a lot of times, gosh, I was really tired that night. And what that is people are kind of running a lot these days on the sympathetic, the fight and flight, the
Adrenaline.
adrenaline, cortisol, like, everybody's very busy. Everybody's on social media. There are a lot of things that really make us feel very out of whack and sort of threatened almost, and causing stress in our life. And what we're doing with the nervous system with the microfrequency is we are essentially bringing their nervous system into addressing the autonomics and bringing them more into a parasympathetic dominant state, meaning that rest, digest, relax, the calm, sleepy feeling. And when people get really, really tired the first night, we know they've probably been operating up here and they're coming down into a state of more parasympathetic autonomic nervous system. And that is where healing occurs.
Well, and I feel like you can do that through meditation, but so many people don't know how to meditate and they can't meditate. So this frequency specific microcurrent could be a way for someone who finds it difficult to meditate to just tap into that frequency.
Yeah. And there are lots of ways to do that. And when I'm working with this, I really guide patients to get the most out of their hour with me. And that is to say they're dressed comfortably, they're lying on a table with like pillows. We make sure they're really comfortable temperature, a little music, and a guide to, helping them be in the present, because there's no better way to access your relaxed nervous system than to become focused into the present. And that present, sometimes I guide people, it's very hard to just say relax, right? So what I try to do with my patients once they're kind of hooked up, and I have the 4 different, the clips and what I'm working on, like beyond the nervous system, can be specific, musculoskeletal or mold or shingles. And we can talk about the indications for it. But I really have people make an effort to get into the present. And the way you can do that, if you need something to do, because most people can't just go there, is that you tap into your senses. You tap into your spatial awareness of space and time. Right now, in this moment, I am in a room lying on a table. I see a fan and I'm here. I see a picture and I'm here, right? It locks you into your present time. And then what do you hear? Do you hear birds, music, your breath? Just, noise outside, right? And then what do you taste in your mouth? That's a very present sense, right? What you smell.
So why is this so important though? What if someone's thinking about what's troubling them in the past or something about that they're going to have to do later in the day? Why is it not, why do you not want them doing that?
Right. Well, I think that we all have had the experience when we're looking forward, when we're worrying about something coming up, there can be a lot of apprehension because, most of what we project is going to happen in the future that we worry about, 99% of it doesn't actually happen, right? Because we're trying to micromanage and control as if it's going to make us safe. Right. And really, experience tells us that it's probably not going to turn out as bad or even as good as we thought. Right. It's just like there's a lot out of our control. We only can control our reaction to it. So when people tend to look forward too much in time, they come out of their body. Right. And they start to have things like anxiety. So when we're too far forward, we get anxiety and trepidation about what's coming up.
Which blocks healing that you're trying to do.
Which takes us right into that sympathetic system, which is survival, right? We're surviving, we're surviving being chased by the tiger. We're surviving our schedule, right? And our body goes into adrenaline and cortisol and all those things that make us feel really stressed out and take us out of our body. And we need to be in our body to heal. So the present's really important for that. If we're looking backward, there can be gratitude, but there can also be regret or I wish I would have done this better or micromanaging the past. That can really cause a sense of depression. And so if you're dealing with anxiety, if you're dealing with depression, ask yourself, am I perseverating on the things that have happened that I can no longer change or do anything about? right? There's a sense of regret or sadness, or I wish I did that better, or I wish I didn't do that at all. And if we look forward too fast, we have this sense of trepidation. What's going to happen is, are they going to react this way? How am I going to get there on time at 3 o'clock? And so the more that we can get into our present by tapping into our senses and then tapping into our breath, even if we do that several times a day, it puts us into a healing zone of parasympathetic. It calms all systems of our body. It increases the lymphatic flow. Doing it before bed helps you sleep better. It helps you get into that parasympathetic rest, recover, and sleep. And sleep is just so good. Quality sleep is so important for our recovery on a daily basis. So when I'm working with people, I really want them to get the most out of the treatment, which is the frequency stim. And I need them to be in their body. I need them to be as much as they can in the present, oriented to space and time. And that's a whole sort of different practice, but that's the basics of how you can do that, because that's really in your present space and time. There is absolutely no threat. You are safe. There's no threat. There's no trauma. There's no emergency. Everything and everybody is okay in the 1 second or the 2 seconds or the 3 seconds. And so it's always really important to, the mantra that I use is, I command my spirit to center, meaning this is my house. I'm in charge of this. If I'm not in charge of myself, somebody else is. And we have so many examples of who else can be in charge of things. So I really want to empower my patients to start thinking about their well-being in a much more active daily practice, in addition to fine-tuning them and really working on specific issues with the microcurrent. I normally see my patients, sometimes at the beginning, I'll see them twice a week. And then ideally we are at once a week. So it's not hugely time consuming. Once we do the frequency session, which lasts an hour or so of treatment, it's very relaxing. They're lying with the towels. They're comfortable. They can meditate. They can, get into the present. They can breathe, all those things, listen to music, just chill. Some people even fall asleep because they're so relaxed. Then they come, that frequency, think about a rock thrown into a little pond. It creates a wave. We're creating a new frequency within those cells of those regions we're looking at in the nervous system, and however specific we need to get with the disease process or the joint or anything specific. That frequency will continue to resonate in their body for several days, as long as they're hydrated. So we need, when I have my patients come in, they're dressed in, comfortable clothing and ready to relax, and they're very hydrated, because that's how energy moves in our body. We need to be hydrated. And so that is kind of their homework assignment, is to stay hydrated over the next several days, because we've created a ripple in a pond, and we want them to stay in that as much as possible. And so after they've experienced it, then they can understand how, like, gosh, I feel really good. Okay, well, there's a buy-in. I want to keep this going. So here are the things that you can do. You can ground, get out in the sun, take some breaths. Don't be on your phone too much. Don't get the tech neck. Don't buy into social media. All of those things really spike our cortisol. And we want to stay in a very healing type. And we're really looking at physics, right? We're talking about physics and resonance and bioresonance with the body, right? And there's lots of examples like this. If you strum a violin in a room with another violin and they're both tuned, the violin that strums sends a frequency into the air, a vibration, and that other violin will start resonating. So there's not only an effect on our own body, but we are connected to each other in this way. We can't see it. It's much like the wind. We can feel it, but we don't see it, right?
It's much like how mother and daughter or girlfriends that all live with each other will start menstruating on the same cycle, right?
We get into a cycle. There is a collective consciousness. There is a frequency. When you're around somebody in a high frequency state, you feel better. They pull you right up into it, right? And you can feel, like I mentioned, you can always also feel that difference. So as much as I can, sometimes I walk down the street and I just stay in my high place. And what I'm emitting and thinking about everyone I walk by is this light and love. And I'm just like, come on up, right? Come on up. Not saying that I'm at the top. It always goes higher, but I really want to affect the people around me in my community, the people I walk by on the street. I love my patients. I have a deep passion for the human body and the human spirit and how it all works together because our body is so intelligent. I'm just at the tip of the iceberg, and I'm always surrounding myself with rock stars because I have so much to learn from both Western and Eastern medicine. And this frequency specific microcurrent is a safe, painless, there are no side effects. So it can work really well. If it doesn't work, we switch some of the frequencies, but I really can work on somebody in a very comprehensive way in a short amount of time. And my patients start to feel it really quickly. So I know that, something's being affected about the energy of the body. Does that make sense?
Well, so for all those listeners who don't live in San Diego, what do they do? How can you help them?
So frequency specific microcurrent, we are, it takes training, and we have trained practitioners that have worked with Dr. Carolyn McMakin, who's now in Portland. She has a tremendous story. She actually wrote a book. I'll show it here. And a lot of people read this book and then find me. It's called The Resonance Effect. It explains so much of what we're talking about in a beautiful way. And she wrote this book, and she's still teaching around the world. And so she has a website, Frequency FSM, or Frequency Specific Microcurrent.com, and you can go in and find a provider based on your zip code. I'm kind of have a niche in San Diego. There's a few people that do this as one of many modalities. I think that I'm the main one that will come up when you look for a practitioner. So you can find a practitioner wherever you are. Sometimes I work with a patient and they have a mom that lives in Michigan, and I'll say, hey, go here and put her zip code in. So there's a practitioner listing around the United States, and I think it's in other countries as well, who have been trained, who have an advanced credential, which I do in FSM, being trained, really understanding like the frequencies and how we're using it, the precautions, the type of conditions that it works on. And so people can look that up, but also I work with a home device. And so I have a number of patients in other countries and different parts of the United States that cannot come into my office. And so I work with them with a new device that actually I can program remotely. It works through an app on their phone. Called iCare, and it runs through a different type of modality. It runs the frequencies that I program, but it's through PEMF. So it's through coils. It's very user-friendly. It doesn't take the wet towels. It doesn't take the clip-ons. You don't have to be an expert in all of this to do it. I can program something into their phone. I have a couple patients in Spain that are playing soccer. I have a couple college students. Those people will come in when they're in town, but then they have to be where they're at. And so they can just message me and say, I'm getting a cold, or I broke my toe in a game yesterday, or this is going on. What do you think? And in about 10 seconds, either I can create a program or send them something that they can download right into the program, and they can use it wherever they are. So
that's amazing.
Sometimes it's telemedicine, like if it's a college student, because sometimes I work on somebody and then they say, well, I wish my son could come in, but he's at college and he's in New York, and I don't think he's going to be able to come, but he's got a lot of anxiety and he's had some trauma and this and that. So I'll do a phone call. I can do a telemedicine, and we can really work through what's going on, and I can make, educated suggestions and send them a device, and, they own it. And it's a little bit different than microcurrent. That would be the ideal, is to see someone with microcurrent, at least to figure out the right frequencies. But I've had a lot of success at this point and experience to have a really good entry point and start the process, and then we can tweak it and fine tune it. So I like to think that I can really work with anyone around the world with this technology. And I love to see patients, but I'm also happy to work with, telemedicine calls, and we can get on just like you and I and really get to know each other that way.
And to own your own device, I mean, can you have too much of the frequency? Like, what if I owned it and wanted to do it every day? Is that too much?
A lot of my patients do it every day, especially people with chronic conditions. So people that have, some of my patients, I see musculoskeletal patients, obviously, like a physical therapist, and you think of a traditional sense, I'm probably seeing a lot of musculoskeletal, pain, inflammation, joint pain, headaches, things like that. But I also work with a lot of patients with Lyme disease, with mold exposure that are suffering in that way with something called MCAS. Fibromyalgia, shingles shingles really responds quickly, especially at the beginning, to frequency specific microcurrent. It really nips it in the bud and decreases the intensity and the length of time. I work with people with irritable bowel syndrome. If you calm down the small intestine with inflammation of the small intestine, and you teach them some points on the, acupuncture points for large and small intestine, and you address the nervous system, a lot of people have a great quick decline in irritable bowel syndrome. I have worked probably on just about everything. I have patients that come in because they can't sleep at night. I have patients that have had PTSD and anxiety. And this is such a beautiful modality and an easy modality with no side effects. The only thing, sometimes if people are not hydrated enough, they can get a little bit of detox symptoms, a little bit of, if you were doing a liver detox. So I always am really careful about making sure the liver and the lymphatic pathways to clearing toxins would be open. And supported. So sometimes we'll start there to make sure that's supported. But I love the work of Neil Nathan. I see a number of his patients. He's like kind of the mold and toxicity expert in Northern California. So I get patients that refer each other, or they're on a Facebook group. And so I'm just so thankful that it's really become like a word of mouth type practice where people are sharing their experiences, and they're like, I don't know exactly how to describe her. It's working, and and like something's really cool about it, and my entire body can feel it at the same time. It's not part specific. So
what about if someone has like they've injured their knee, like you said, or they've like a meniscus issue, or they have like a slip disc or something in their spine that's you wouldn't think that is a frequency thing, that's like a hardware thing.
Yeah. Well, so the way that it works is there's say an injury to a joint or an arthritic, generative type thing. What frequency specific microcurrent can do is it can affect the tissue, the wound healing of a tissue, a post-surgical wound healing. It speeds it up physiologically. Somebody that's sustained an injury, this is used widespreadly in the NFL and on people that are really fine-tuning their health and they're getting injured a lot. So it can speed up the physiology of healing. So wound healing, it's amazing for. Somebody that has arthritis, it works on, the inflammation of that joint and bringing vitality to the parts of that joint in all of and each of those tissues that support the joint. What it can't do is replace anatomy. If you have lost half of your meniscus, I'm not going to tell you that it's going to regrow your meniscus. It's not going to. But the anatomy that you have, it can support. So let me just give you an example. Somebody that has thyroid issues. There's a number of things that can happen to the thyroid. Let's actually use the vagus nerve, because that's a buzzword. Everybody wants to know about their vagus nerve. There's sprays and scents and stimulators, things. We're all trying to bring out that calm parasympathetic feeling to sleep and to relax and to heal. But the way that FSM goes about looking at the vagus nerve is not just decrease inflammation in the vagus nerve. It goes right along here. It gives off branches to our larynx. It gives off branches to the aortic. It wraps around the aorta of the heart, and it determines our digestion, our stomach acidity, our calmness. It goes, kind of this whole section it starts in the medulla of the brain at the base of the brain stem. It comes down in the carotid sheath, and it affects everything through our intestines and our genitoureteral system and so many systems of our nervousness. And so if we look at, if somebody has a whiplash, if somebody is sick, those things will affect the vagus nerve for a few different reasons. In a whiplash, it can actually be pulled. We call that torn and broken. So we can actually have physical damage to the vagus nerve because of the location in the neck and the whiplash type thing. So there are programs that look at, 124 and then the nerve. And so we can look at the vagus is 89. So it'd be 124, 89 would be the combination for torn and broken of that. And then there would be another frequency for a virus. So say somebody gets COVID, or say somebody gets a cold and then they lose their voice, much like me right now. I've had like a little stint with an international virus of mystery. people come in hoarse. That a lot of times is the vagus nerve torn and broken, or we can take virus. We can do a program for virus or bacteria from the vagus nerve. We can do increased secretions of the vagus nerve, right? So we can do vitality of the vagus nerve. So a lot of times we're looking at it, we're going to run a lot of different frequencies because we know or we don't know, but it's much more involved in just stimulate. We don't just want to stimulate the vagus nerve. We really want to address the different reasons why it might not be working. And there's actually some different physical tests to see if your vagus nerve is working. And so we do those when you come in. I can see which side is working or not working. The voice is different. So like, I think that there's some really cool and comprehensive ways to work with specific anatomy, whether it's the vagus nerve or the thyroid. We can really enable and create vitality in each of our body parts, which then creates the frequency, increases the energy through the ATP and the mitochondria. That's our powerhouse. That's the energy of each cell. And it puts us in a zone where our body is better able to heal itself. So at the final summarization of how this works is we invoke a condition, increase the ATP and energy of the cell in those specific areas of anatomy that I've assessed to be in need after a long subjective. And then we are putting the body into a zone of resilience, a zone of intelligence, and we're connecting a lot of different dots for somebody. So their body can heal itself in a more physics way, less of a chemistry way. So there won't be the side effects. They can tell relatively quickly if something's changing. And it's really starting to heal on a lot. And we haven't even talked about like the mental and emotional planes that have to do with why something could be hurting in the first place. But it's able to go into all those levels, which is really, really unique and really, really special about frequency specific microcurrent. That's why I'm in absolute awe and love with it. And I think it's the fastest, best modality I've ever used. And I do less and less manual work because this just gets to it in a quicker and more efficient way. And I'm super smart in that way. It's really fun for me, actually.
No, it just sounds amazing. And you can tell that you're so passionate about it. And I love hearing how it's just helped so many of your patients with a wide variety of symptoms, right? And I'm just looking at the time, and I want to respect your time, and
Thank you.
but we could probably have another podcast about this because I feel like we could even go deeper in, like you said, the emotional aspects of it. But how can people get a hold of you, Lara, if they want to learn more about this or they want to, work with you in some way?
Sure. So I have a website that has a lot of information on my background, frequency specific microcurrent. They're using it in the Cleveland clinic. So there's like a lot of really good evidence and science if you're a geek on that. And that is my website is Lara Langdon, pt.com, LARALANGDON, pt.com. That's my website. That has the information. I'm located in Encinitas. You can look up Indigo Dragon Center to find me, or you can just look on my website. I practice with a group of acupuncturists and like-minded individuals. So we all came together as a group. So that's my website, and you could post my phone number if you want.
No, I think I'll just send people to your website. That'll be great. And it's just good to know that you work with people locally, but you also work with people around the world. So I love it.
Right. Yeah. And I'm on LinkedIn as well. So that's my name. And so, yeah, thank you so much for having me. It's always a pleasure to share what I'm doing. I have a great love and passion for bringing light into suffering. I'm not a fan of suffering. I don't think we get credit for it. So I think we have a possibility of feeling really well and resilient all the time. And I just love to see people, the light come back on in people's eyes. So thank you so much for sharing this and for having a little podcast around this, because it could potentially help a lot of people.
I think so too. Thank you so much for all the work you're doing. It's a pleasure.
Thank you so much.